KINZR. And Dr. Mensink from the practice with us this afternoon. Doc, how are you, buddy?
I'm doing fantastic.
Hey, listen, I got the prescription the other day for the new antibiotics. I'm taking those, and the condition seems to be, it's a lot better than it was. So thank you for that.
You're welcome. Thank you.
I appreciate that. I heard a commercial before we get to what we wanted to talk about today. I heard a commercial that you did, and I felt so bad for this poor woman. Her husband comes into practice, right, and tells you that she had a gallbladder operation. Tell us that story.
Well, it's interesting. I had a patient who came to see me. Actually, her husband brought her in. She's a 51-year-old Hispanic lady. Make a long story short, she got belly pain, a little bit overweight, got belly pain, went over to one of the ERs, actually Memorial Emergency Room, and essentially they took her up to the operating room and took her gallbladder out.
Wow.
And
all at one time?
Yeah, she's there for a day and a half. They discharged her. She has no insurance. She's got a bill for $51,000. And, the guy has just panicked. He's getting ready.
$51,000?
He's getting ready, Jazz, to put up his home. He's got home with equity. He's getting ready to put up his home to pay this bill.
Oh, bless his
heart.
heart.
Memorial sent him over to me, to the practice, because he has no insurance. And we're glad to see him. And he came in. He was sitting in the Scottish room, and he came in, and he had an attitude. And I don't blame the man. Believe me. I mean, you would too, And he said to me, he pointed his finger at me and says, Jazz, he said, what would it cost if I had a long practice to get this gallbladder fixed? And I said to him, no, sir, I don't like to tell you this, but we've negotiated with one of the hospitals in town and with one of the groups, and hospital, non-emergency gallbladder, hospital, surgeon's fee, anesthesia fee, medicines, OR fee, everything is $3,600 cash, but up front. Now, that's for people with no insurance, okay? And we have a group that we work with that essentially they've set this up for our patients with no insurance. We want people to have insurance, Jazz, by all means, don't get me wrong. But we've negotiated a lot of these things, like you need a hernia, I think it's about $3,800, if I remember right. But a lot of these discounted things. The goal behind the practice, Jazz, is cost-effective quality care in a concierge environment. And that's kind of says it all. And it works. I mean, I want people to have insurance. Believe me, it's much easier for me. We don't mind most of our patients have insurance. But it's much easier for me if you have insurance. But we're not afraid of people with no insurance. We'll work them.
It's also difficult if you do. I have a $5,000 deductible. I had a $500 deductible before Obamacare. And now I have a $5,000 deductible. I just, so if I were to have a gallbladder operation, it was $50,000. I would owe them the $5,000.
It's cheaper to belong to the practice, have no insurance.
You have no insurance. And then, I swear to you, that is what I've been thinking about, because Dr. Mensink, if you don't know, this is my doctor. I'm a member over at the practice. And I don't see why I'm paying $125 or $175 a month for insurance here. If I can't, I went to see an eye doctor recently, and I'd seen him before. Dr. C is his name, which is a great guy and
good doctor.
Good doctor. And he did surgery on me here a few years ago. And my first visit, I paid a $20 copay. That was it. And the procedure was completely covered by my insurance, and I didn't get a bill from anybody. I went back to see him again recently for a condition that I thought I was developing in my eye. I paid a $20. A week ago, I got a bill for $90, which is the balance of the office visit. He didn't even perform any procedures, just dilated my eyes, looked inside with a microscope, and said, no, it's not a problem. Because I had a torn retina before, is what it was a torn retina. So this is crazy.
Well, Jazz,
this is our insurance situation.
The practice is not insurance. And
no, it is not.
That this is not insurance, and we encourage people. In fact, if you go on the website, we have an article that we've reprinted about 8 legal ways to essentially, I was going to say beat Obamacare. That's not the right word to say, but that will cover for the Affordable Care Act.
Especially with your history.
But there's and they can go on the website and look at that. That's free for the community to look at, and it's really worthwhile because there's 8 different ways that most people are not aware of that legally you can qualify, so you don't have to pay the 1% penalty kind of thing.
Right.
And that's there's a lot of things there. There are many ways to sort of do it correctly and properly. We encourage people to get insurance, and especially if their income is low, to get Obamacare. Whether
you have to do it, yeah.
I encourage, especially if it's subsidized, because that's free money. I don't look at people as bad for taking advantage of that. I look at it as us as a country. If we give away too many things, we're the stupid ones, not the people taking advantage of it.
They're taking it.
It's a different way of looking at it. But take advantage of those things if you don't have insurance. But we have many, many patients that join the practice that can't afford. I saw a lady the other day, Jazz. Actually 2 weeks ago, and she came in and she said she came in to join the practice. She's making $11 an hour. She's single. She's by herself. She needs medical care. She went on the website. She joined for the Obamacare, and it cost her $11 a month. Her deductible is $5,000.
Jeez.
And she says it does me no good.
What's the point?
It does me no good. And so she joined the practice. And we have many, many people doing that. I look at, if I was in government, all right, very careful what I say here,
Lord,
but if I was in government, or let's say I was Surgeon General, I don't know what emphasis I have in Surgeon General, but if I was a member of Congress, let's say I was Kevin McCarthy's job, what I would do, we have emphasized insurance such that insurance covers everything, all right? It's like having your car insurance, but we no longer have insurance if you have an accident. We now cover for the spark plugs, for the wiper blades, and all that kind of stuff, all right? And it's killing us. It's costing us. If we as a practice, if I can, for the majority of my patients, 85% of our patients that join at the $69 level, 85% of their care is covered by the practice. If I can do that, why is it that it's taking, for instance, hundreds of dollars per month? And I don't want to say on what it is, actually, but it's a massive amount for just Kern family to do the same thing for primary care.
Really.
See,
Absolutely.
Private business works. Number two is if we would take and have everybody do the practice in our county, let's say all the poor people or everybody, all right? And let's say we gave the practice. I'm not advocating this, but let's say that we gave the practice to everybody, all right? Now, and then you buy your insurance for all the emergency things.
Yeah, the big things like gallbladder surgery.
Yeah, and all the other things, that happens. Two things happen. Number one, it emphasizes personal responsibility. Do you follow what I'm saying? Mm-hmm. Number two, you're now giving people the ability to have top quality medicine to prevent these things. So there's no excuse kind of thing. And I believe it in the long run probably would be a cheaper way of doing it, because it is so much better, Jazz, when you can see people early, not late. I saw a lady this morning, and she has a different one of our insurances is free in this county. She's a low-income person, and she's a diabetic, hypertensive, and life is a mess. She's 62. Her hemoglobin A1C is over 13. All right. I mean, this is terrible, Jazz. Her blood pressure, her diastolic blood pressure was 98. And we went through everything and started to get everything straightened out. And she says, Doc, you're the first person I've seen. I've been going to all this other clinics. He says, they've never touched me. They don't do anything for me. They just give me a script. You're the first person to explain to why I have to do this. Now, I have time to do that, Jazz, because of the way the practice is structured. But our country is starving for good primary care. I hear that all the time. You call up to see the doctor, and we'll see you in 6 weeks for 5 minutes.
Yeah,
kind of
right.
thing.
Exactly.
That's not good medicine.
Mm-mm.
It doesn't work.
No,
it doesn't work.
We'll take a break. We'll come right back. Our phone number is 399-1560, by the way, if you have a question, if you'd like to talk with the doc here this afternoon on the Jazz McKay Show. The number for the practice, by the way, is 871-3300. That's 871-3300. Call them, make an appointment to go by and just sort of check it out and see if it might be something for you. $69 a month, and you get to see the doctor whenever you desire. Yeah, the fair's going on. So you're out at the fair, which is always a lot of fun.
Yes,
and
it's hard work, and by the end of 12 days, it's kind of drags on you, but it's good.
No
we
kidding.
meet a lot of wonderful people there, seriously.
Yeah, and which building are you in?
3.
Building 3. So drop by and see who's out there.
Wanda and Betty and one other salesperson, and myself usually in the afternoons.
Okay. Now, you mentioned asthma. I was diagnosed as a kid with asthma. And basically that was to get out of PE class. Just PE was not my thing. And so that worked out fine. And but of course I started smoking when I was about 19 years old. And that compounded the problem.
Puts you at greater risk for COPD down the road.
And I think that I may be borderline on that. We haven't talked, I haven't talked about that. We need to do that one of these days. What are the tests for COPD, by the way? Is it you blowing into a thingamajig?
Yeah, well, COPD, actually, let's talk COPD, chronic obstructive pulmonary disease. Think of it as a permanent variant of asthma. That's not really true what I'm saying, but that's a good way of thinking for the public. So asthma is wheezing, and it's called reversible airways disease technically instead of asthma. Kids, like you mentioned, your kids, 40% of kids grow out of their asthma, all right? But they're more susceptible to reversible airways disease down the road, especially if you smoke. But asthma itself is tested. When you come in the office, the simplest screening is to do what's called a peak flow. Every patient that comes in with any respiratory complaints or upper respiratory complaints, we do a simple peak flow. And essentially, you blow into this machine. Mm-hmm. There's a little plastic thing with a little thing you blow, like try to blow your birthday candles out. It gives us a very quick, accurate peak flow. It's cheap. It's fast to do. The only thing about the little machine, which is a piece of plastic with a special metal thing, membrane in it, yeah. Costs about $50. That's the only thing I have against it. But
is it a one-time use thing?
No. We use it over time. But it's a very quick way of looking at your peak flow. Like I had a person come in this morning, and I usually show them how to do it. I breathe in, and I will breathe and blow out, to blow out my birthday candles, so to speak, and I'll have a peak flow of maybe 650 to 700. That's pretty good. Good lung function. This gentleman came in to see me, and he has upper respiratory tract infection. It's gone into his chest. He doesn't, by the way, have any wheezing, but he's coughing. And people don't realize coughing is often associated with asthma. In fact, there is a variant of asthma called cough asthma. But his peak flow was 270. Now, that's almost a third what I'm breathing. Well, maybe 40% of what no, doesn't smoke. Mm-hmm. But that's just a patient's in trouble. In fact, if your peak flow goes down below 200, we in the office, we'll see you every day, all right? Because at 200 or lower, the risk of you decompensating and going into the ER just shoots up logarithmically.
What do you mean?
Decompensating, essentially you get too tight and you end up having to go to the emergency room and put on a ventilator or whatever. All right, these bad things. Yeah.
Really?
So that peak flow in the office, a simple screening, is very fast. It's cheap. It's fast to do. Now, once you do that, like if you came in to see me for asthma, I would treat you, all right? And essentially we treat all our patients, most of our patients, for 3 weeks, all right? Then we bring you back at the end, all right, 3 weeks from now, and you're feeling great. You think I'm a wonderful doc. You're feeling great. You don't know problems. And we repeat your peak flows to see, are you back to normal? Because two things happen. Number one, if you're not, then we essentially set you up for what's called pulmonary function studies. This is a little machine. You blow into this, and the computer does a bunch of things, and it tells us your lung age and where the issues are and how much of it's restriction versus wheezing. And it doesn't cost very much to do. I think we charge $50 if I remember to do it. But here's the thing, Jazz. I don't mind you having asthma. I don't mind you wheezing. We'll treat it. No big deal. Away we go. All right. But here's the two issues. Number one, I have to ask, why do you have this? All right. And many of these patients have low immune systems. All right. That's one of the reasons why we're so aggressive with D3 supplementation to get their D3 levels up. Number two, the second thing is that if you have asthma, you have to get better. And at 3 weeks' time, we bring you back and we check your peak flows again, because I want to know if you're back to normal. You see, if you have a normal peak flow when you're finished, you're going to do fine. But what we find is many of these people that wheeze or have troubles like this patient with cough asthma, they think they're doing fine, but he may only have a peak flow of 350 or 400. And he's walking around and he thinks he's normal.
Yeah, because it was at 200 before.
Yeah, and he thinks he's doing fine, but he's really breathing 2/3 of what I would be breathing. That person has to be treated up to normal, not by how they feel, but by that little peak flow machine. In fact, we send our patients home with the little peak flow machines who are chronic asthma patients, because the asthma kid, say, that comes in, or the asthma adult for that matter, you do not treat them to how they feel, and they're not wheezing. They have to be treated to the peak flow being normal. And I can't stress that enough, because we see so many of these patients that, I'm better. This doc was wonderful. I feel great. But they're breathing maybe 2/3 what they should be breathing. If you're walking around like that, bad things happen down the road. Those cannot be missed from my point of view. And those are the ones we treat aggressively, and there's long-term.
Now, what are the treatments? What are the treatments?
Well, first of all is we use what's called albuterol or different types of medicine like that. They're alpha agonists, essentially they dilate the bronchial tree up. They're fast-acting, the little inhalers.
Inhalers?
All right?
Okay, all right.
That's the first thing we use. And they're usually fast-acting, they're rapid, they work fairly well. You can also use them in breathing machines. But that's the standard, all right? Number two, there is a second thing for acute exacerbations are steroids, all right? And either IM steroids, we use a lot of what's called Medrol dose packs, essentially a little package of decreasing the amount of steroids over 5 days. It works quite well. Or prednisone, things like that. And then long-term inhaled steroids that are local. Injectable steroids and pill steroids like prednisone, Medrol dose packs are not good for you long-term. They are disastrous, very bad for you. Plus, they decrease your immune system. But if you use the inhaled steroids, like KINZR is probably the prototypical one, what happens is that steroid is just injected or inhaled into the lungs, and it doesn't go through the whole body. So it's just affecting the lungs, and it is very good. And that's the second step of treatment. Then the third is there's different medicines and pills and special inhalers that you can use that are long-acting that have to be done if you have long-term problem. But the key is to recognize that, Jazz.
Now, what is, I have moments, doesn't always happen, where I wheeze. And I think that probably I notice that a lot more in the morning or early afternoon than I do later. What is it that causes the wheezing? Is it constricted airways or is it mucus of some sort?
Or both.
Both.
Or both, all right? When you start to get into chronic obstructive pulmonary disease, the first thing is there's wheezing from some irritation, all right? It could be allergy, it could be smoke, it could be dust. There's a dozen one things, all right? The second thing is when you get chronic inflammation of those airways, the body produces more mucus. That's part of chronic obstructive pulmonary disease. What it is, you're coughing up this phlegm all the time. It's interesting. When you wheeze in the morning, when you wake up, two things are important. In fact, if you wheeze at night, there's a special variant called nighttime asthma. A lot of people don't realize, where you only wheeze at night. Those patients, several things are very important. Number one is that they have to be tested for reflux. A lot of people don't realize this. 75% of all asthmatics have reflux, where they reflux acid into their stomach. And at night, one thing that complicate that, especially if you wake up with coughing spells in the middle of the night, they literally are refluxing what we call, and they bring this acid up into their stomach, from their stomach up into their throat. And they're at night, and they're relaxed, they're sleeping. Their protective reflexes aren't in their throat aren't good, and they literally what we call microaspiration, and little drips of this acid goes into the lung, and it causes spasm and makes them cough and wheeze. And that's very important for a doctor to look at to see, is that an issue? Because those patients have coughing at night. Another thing, when you see coughing at night or in the morning, there's things like pillows. You want to have a pillow covering that does not breathe. Is that the right? Yeah. That doesn't
hyperallergenic?
Well, no. Yeah, that's good, but more important, that covers the pillow. The zips up, so none of the potential allergens in the pillow get into. Number two, many of the patients at night with night asthma have actually dust mite asthma, all right? And there's dust mites.
Ew.
Okay, and they get into the bedding. That's one of the reasons why you if you have asthma, we'll tell the parents the first thing you do is you cover the bed with some kind of like a plastic mattress cover and the pillows.
Sure.
Right? So they can't. Number two, you want to stay away from feathers and down type of things because they harbor a lot. Number three, the CDC recommends, I think it's even better to do it more often, but you should your bed sheets should be no longer than a week old. You should wash the bed sheets every week. The other thing that's important, and we tell our chronic asthma patients this, and it's cheap to do, and people don't realize what a difference it makes, but we tell them to buy a new furnace filter every month and put a new one.
Really?
Brand new one. You can buy them down at Lowe's.
They're only a couple of bucks a piece.
Yeah, a couple of bucks a piece. And essentially, I don't care what your furnace filter looks like. Oh, this looks new. I don't need to put a new one in. A new one every month. It's a couple bucks, but it saves a pile of money, because of it catches a lot of that micro.
Well, I was going to say most of that stuff is microscopic. You can't see it necessarily.
That's true. You can, in fact, we have in our home one of these fancy. I was going to say air cleaner filter thing that takes all these very small particles out, but those are expensive. I mean, you can spend thousands of dollars for that, and they're very good, by the way. But Not everybody needs that. Not everybody can afford that. Just simple things like vacuuming your your drapes and your furniture, less carpet, more solid floors. What else? No pets in the home. That's another thing.
I was going to say less cat hair.
No, it's true.
Yeah,
It's true.
I know it is. I know it is. But with the dust in the air, well, I'll tell you what. Can you stick around?
Yes.
Let's take a break and come back and spend a couple more minutes with you, because I wanted to ask about the dust in the air and how that exacerbates my asthma.
Okay.
And a lot of folks out there, I'm sure, have the same problem. We're with Dr. Mensink from the practice today. 871-3300. That's the number for the practice. Give them a call and set up a time where you can come in, and they'll talk to you all about the special service that the practice has to offer. But as you can tell right now, I'm not wheezing. I'm kind of breathing normal. I coughed in the break there, folks, just so you know. But I will hear myself wheezing. It's not that loud, but that's the way it sounds. It's a kind of a rumble in the chest when I'm on the air, when I'm talking. This microphone's very sensitive. I'm wearing headphones. I can hear it. I don't know if people can hear it at home.
Maybe that guy back in that back room
guy
filters
back
it
there.
out. I don't know.
There's a filter for that sort of thing. Actually, there is. And
Is that right?
Yeah, it's right over here to the side, and it's called a gate, and you can set it to a certain setting where when there's no sound or very low sound, minimum sound coming through the microphones, that it literally cuts the microphone off.
Oh, really?
And we have a gate that is set, pretty high, but not to that level. But I have set it that way at times, and I cannot hear. But it's weird how it works that way.
Another thing that a lot of people don't realize, there are simple things, Jazz, that you can do for your asthma. For instance, low magnesium levels, marked affect asthma. Another thing, decreasing the amount of meat protein and eating more vegetable protein. Decreasing milk intake makes a difference.
Well, I've heard that. No, and that goes back to when I was a kid, when we were hearing all these reports about milk causing mucus.
Yes, it does. It does. Omega-3 fatty acids, all right? Deficiencies will make it worse. Ginger and turmeric can help asthma. A lot of people don't know that. Ginger and turmeric. We've mentioned vitamin D3 levels. Avoiding nitrites and nitrates. That doesn't mean much to most people, but a lot of prepared, like bologna and luncheon meats, full of these nitrates. Very bad for
I
asthma.
love nitrates. I just do. I love bologna.
No, it's there is no easy answer for asthma. We have people that are born with it and are going to have it forever. The key is to be really aggressive with control, and I can't stress enough, Jazz. We talked about it before, the earlier segment. You need to make sure for these patients, when they think they're normal, you don't treat them to how they feel. You treat them by the numbers.
By the numbers,
and it is just so important.
Yeah,
so important.
Yeah, and like we discussed those. What about the treat? What about these inhalers? I see what is the one that looks like a little disc?
Oh, yeah, the Advair discus.
Advair, yeah.
Very good for
COPD and
yes,
asthma.
Very good. Here's the problem we have with asthma from a medication point of view. All of the medicines are expensive, very expensive. In fact, the newest thing with inhalers for asthma, there are some fantastic new inhalers that essentially, like your albuterol, for instance, that are actually powdered albuterol that you just blow a powder in.
Right.
And,
well, that's what the Advair is.
Well, this is totally different. It's the same kind of idea, but different.
Okay.
But all these common medicines are, instead of using an inhaler, we know that if inhaler isn't used right, and there's studies showing, lots or a few, but often the inhaler doesn't work well, and much of it is essentially goes in the back of the throat and doesn't go into the lungs where it's needed.
Right.
Well, there are these brand new inhalers that are made out of just powdered aerosol solutions. They work wonderful, but the cost is, oh my gosh.
Really?
It's if you think that most asthma medicines are expensive, you get into that stuff and it's just another level of just expense. So it doesn't make, unless you have very, very good insurance,